The World Health Organization, which had earlier decided not to declare monkeypox as a health emergency, just recently declared the virus a public health emergency of international concern. And the trend just keeps rising. In its latest address, the World Health Organization on Wednesday said that there have been more than 18,000 cases of monkeypox reported globally from 78 countries, with the majority in Europe, and asked the at-risk men to reduce their number of sexual partners.
Director General Dr. Tedros Adhanom Ghebreyesus, after taking into account the alarming global rise in monkeypox cases, had on July 23rd declared the monkeypox outbreak a public health emergency of international concern.
On Saturday, I declared a public health emergency of international concern over the global monkeypox outbreak.
As the emergency was announced, the rise in cases seems to still be alarming, as the United States has now become the global monkeypox capital, as a record-breaking 1,048 diagnoses brought the total cases to 4,639, overtaking the Spanish count of 3,738 infections. And in another address by the World Health Organization Director General, Dr. Tedros said that so far 98% of monkeypox cases outside the countries in Africa where the virus is endemic have been reported in men who have sex with men. He urged that group to consider reducing the number of new sexual partners and swapping contact details with any new partners. So far, 5 deaths have been reported and about 10% of cases are admitted to the hospital to manage the pain caused by the disease. Tedros added,
1,000 cases of monkeypox have now been reported to WHO from 78 countries, with more than 70% of cases reported from the European region and 25% from the region of the Americas. So far, 5 deaths have been reported, and about 10% of cases are admitted to hospital to manage the pain caused by the disease.
The WHO chief, on if this outbreak could be stopped, asserted that the monkeypox virus outbreak can be stopped, and said if countries, communities and individuals inform themselves, take the risk seriously and take the steps needed for transmission, it can be stopped.
This is an outbreak that can be stopped if countries, communities and individuals inform themselves, take the risks seriously and take the steps needed to stop transmission and protect vulnerable groups. The best way to do that is to reduce the risk of exposure. That means making safe choices for yourself and others.
The Centers for Disease Control and Prevention has emphasized the importance of reducing stigma in communicating about the demographic aspects of monkeypox, as the overwhelming majority of cases have occurred in the community of men who have sex with men, especially those who have multiple sex partners. And on this point too, Director General Dr. Tedros asked the at-risk men to make safe choices and also reduce the number of their sex partners. He also stressed that nations need to curb stigma and discrimination, as they are capable of being more harmful than the virus and could lead to further outbreak.
For men who have sex with men, this includes, for the moment, reducing your number of sexual partners, reconsidering sex with new partners, and exchanging contact details with any new partners to enable follow-up if needed. The focus for all countries must be engaging and empowering communities of men who have sex with men to reduce the risk of infection and onward transmission, to provide care for those infected, and to safeguard human rights and dignity. The stigma and discrimination can be as dangerous as any virus and can fuel the outbreak. As we have seen with COVID-19, misinformation and disinformation can spread rapidly online. So we call on all social media platforms, tech companies, and news organizations to work with us to prevent and counter harmful information.
India also just recently reported its 4th case of the country, with the 4th infection having been reported from Delhi. Interestingly, when Serum Institute of India's chief Adar Poonawalla was asked if SII would start manufacturing the monkeypox vaccine by NDTV, he said if there's a larger breakout of monkeypox cases in India, his company is willing to import a few million doses of a Danish smallpox vaccine. Smallpox vaccines can be used to treat monkeypox. Adar Poonawalla also said that his company is willing to use its own funds to purchase the Danish smallpox vaccine manufactured by the Danish company Bavarian Nordic to vaccine people in India against the monkeypox virus. Adar Poonawalla said that his company is in talks with the Danish smallpox vaccine making company, but if India should stockpile a few million doses of the vaccine, that's a decision the union government will have to make.